Hi, Candace.
Hi, Dr. Sirven. How are you?
I'm good. How are you doing?
Doing well, thanks. Thank you so much for joining me. I really appreciate it.
Oh, it's my pleasure. Thank you for having me.
Absolutely. So, what is epilepsy for those who don't know?
Epilepsy is a condition which basically presents with having seizures. A seizure is basically an abnormal electrical discharge of the brain. And so epilepsy is almost like the plural of having repeated seizures that are not provoked by anything specifically. 1 in 26 people, Americans typically, will develop epilepsy over their lifetime. So it's fairly common.
What are some of the most common myths and misconceptions about it?
Yeah, there's a few things that are out there. Number one is that there are myths related to the fact that people with seizures can't work, that they can't function, that they cannot be out there in the world. There are, in some places, and I don't know where this one comes from, there are myths that seizures are contagious or almost like an infectious thing. Uh, I don't know where these have come from, but in general, these are things that people have to kind of overcome in terms of the general stigma related to the condition. But none of this is true, because if you look at the people out in the world who have epilepsy, it truly is a who's who and everybody, because this is something that can affect anyone from an infant to an older adult. Anything is possible.
I was always under the impression that it was something you were born with. Is this something that can be prevented?
You know, there are some preventable forms of epilepsy, but the truth is, epilepsy has so many different causes. In an infant or young child, there may be a genetic underpinning where basically, yes, they are born with it, but in a teenager or a young adult, head trauma, there are some infections, certain brain tumors, strokes. All of these can cause seizures. And if you take each of those on its own, some of those are preventable when you think about it. Head trauma, for instance, or for that matter, some versions of stroke as well. So yeah, seizures kind of and epilepsy sit right next to the biggest causes of neurological problems that exist currently anyway.
And when someone develops epilepsy, is this something, like say for instance, if they have a stroke, as you mentioned, is this something they'll have to live with forever, or is it something that could be temporary?
It varies a lot. We do know that in some cases, seizures in some cases, they can actually go into remission. But there is another group of people where it is lifelong. And there's so many different versions of epilepsy and seizures that it just will depend on that individual. But that's why it's important that the person always be evaluated by their physician or neurologist or someone who can help them, because that is an exact question that anyone who develops seizures should be asking their doctor, because the answer can vary so much depending on the situation. Let me at least offer this piece. There's always hope, and not everything fits nice and neatly into one category when we're talking about seizures and epilepsy. There are a lot of different ways that this can go.
And how is epilepsy typically detected?
Typically, these seizures can present in a number of ways. The most dramatic are what most people think of seizures, what we call a convulsion, stiffening, shaking, falling to the ground. However, seizures can also present as staring or loss of consciousness, or it may be just a certain movement of an arm or leg, or it may be very quiet where they just have lost track of time and they're not processing information. And unless someone's asking a question, no one may be able to detect it. you see, wherever there is an abnormal electrical discharge of the brain, and whatever part of the brain that your body's being controlled by, that's the way the seizure is going to look. That's what makes it so hard, is that there's a lot of different ways that this can look like. The key is, if someone's having repeated events, they're lasting less than a minute, and it's affecting quality of life, that's a reason to go see a neurologist, a doctor, to basically help figure out what's going on here.
My grandmother, she had dementia, and it was strange. They never found out that she had Lewy body or anything like that, but she had moments, and we could tell just by looking at her eyes, okay, she's going to go down in a minute, and then they wouldn't last long. So, as you mentioned, it's something that can develop at any age or any circumstance.
Yeah, 10% of people who have Alzheimer's type dementia do also have seizures or epilepsy. And in cases, especially in the older adult, it's important that one rules out that they're not having seizures, because seizures is treatable. We have a lot of medication options and other treatments that can be done for these folks. And so instead of just making the conclusion that, this has to be dementia or something in that direction, where there aren't a lot of options to change it, it's important to make sure that there isn't something reversible there that we can do something and intervene for.
Absolutely. And how is epilepsy typically treated?
Epilepsy can be treated in a lot of different ways. The first thing is what I always tell people, easy things to do at home. They include things as making sure they get sleep, manage stress, that they basically are avoiding alcohol. Those are the big three, if you will, in terms of potential things that can bring it up. Outside of that, then you're looking at medications, a lot of different medications that are available, more than 20. And outside of that, if medications don't work, we have devices that can be implanted, kind of like pacemakers for the brain. There are also surgeries that are available for certain cases. There's even a certain diet that can be employed. Lots and lots of options here.
And I hear there's a minimally invasive laser surgery available. Can you tell us a little bit about it?
Sure. The minimally invasive laser surgery, there is a new technology. It delivers almost like a focused laser to the area of brain that is causing the seizure. So you have to know where the seizures are coming from. And it allows you to target it so precisely that you don't have to have this huge opening to get to that target, which is what we often think of in brain surgery. So this is, it gives you a small window to basically get to that area of brain that you're interested in, allows you to kind of target it, pull it out, and the recovery is strikingly fast. People can leave the hospital literally by the next morning. And that's a rather remarkable change, because it used to take weeks for people to recover from some of these procedures. So that's another example of a nice technology that has truly helped us in terms of making management a real possibility for folks who have seizures.
And do you have any additional information you'd like to share with us?
Well, I will tell you, if someone is having seizures or think they might, there are a lot of great epilepsy websites and sources of information. Check out the ones on Mayo Clinic. Check out epilepsy.com, that's by the Epilepsy Foundation. Check out aesnet.org by the American Epilepsy Society. These are wonderful sources of information for either your physician or for yourself. And just know that you do not have to suffer quietly. There is help out there. You just have to ask for it.
Well, thank you so much, Dr. Sirven. I really appreciate you taking time out of your busy schedule to speak with me today. Have a great afternoon.
I appreciate it, Candace. You have a great afternoon as well.
Thank you so much. Bye-bye.
Bye-bye.